That's week 3, turn 7 of my MASPE treatment. That is bone level expansion that will expand my palate. Right now, we're looking for my palatal suture to open. You can hear I still have contact there between my 2 front teeth. So as soon as there's no more contact between my 2 front teeth, I'll get to start the clear aligner portion of my treatment, which will move my teeth around as we're expanding. Now, just because you had adult teeth extracted for orthodontics, of course, doesn't automatically mean that you're going to have a problem. In our office, we are seeing the people who come back in from having the issues because that's the type of practice that we have. One thing you can do if you've already had this happen is have an evaluation by a myofunctional therapist. They'll evaluate your tongue space, posture, and function, and help you learn to retrain your tongue if it's not working properly. If you did have teeth taken out and you are having issues like airway issues, TMJ, jaw pain, clenching and grinding, you can see a provider who does MARPE or MASPE appliances to see if you're a good candidate for expansion. Of course, not everybody will be a good candidate for expansion. Not everybody is ever a good candidate really for any type of treatment, but there are other types of treatment as well that can help. For example, orthotic splints. What we're trying to do is bring awareness that we should always expand the mouth whenever possible instead of extracting teeth and retracting the mouth. Most people would agree that aesthetically, it looks a lot more pleasing to have a big smile. Even if you think about it from the most basic level, we all have a certain amount of teeth, right? If we were born with 4 wisdom teeth, we start with 32 teeth. Why would we be removing adult teeth if we have the option of expanding and keeping them? Because as we get older, what we see a lot of times is deterioration and breakdown of the teeth. So if we take 4 out when someone's young, when we had the option of keeping them, we're already putting people at a disadvantage.